Okay, well, welcome back, everyone. We are going to go ahead and start with our first speaker of the day. It's my pleasure to introduce my friend and colleague and our first keynote speaker for the day, Dr. Catherine Lord. Now, Dr. Lord will be sharing her thoughts and research on families and autism, with a particular emphasis on caregivers and siblings. Following Dr. Lord's lecture, we will be hearing from our community discussants, Doctors Allison and Andrew Gilbert and their children. But by way of background, to tell you a little bit more about Dr. Lord, Kathy Lord is a George Tarjan Distinguished Professor of Psychiatry in the David Geffen School of Medicine at UCLA. Dr. Lord is a faculty member at the UCLA Tarjan Center and is a clinical psychologist. Her research focuses on autism and related neurodevelopmental disorders across the lifespan, from toddlers through adulthood. And her work primarily focuses on improving methods of identifying strengths and difficulties in autistic individuals and those suspected to be autistic, while working with families and individuals to maximize independence and well-being for all concerned. This has involved the development of gold standard diagnostic instruments for diagnosing autism, which include the Autism Diagnostic Observation Schedule, also known as the ADOS, the Autism Diagnostic Interview Revised, or ADIR, and the Social Communication Questionnaire, also known as the SCQ. Dr. Lord is also very interested in graduate training for psychologists and other clinical researchers in autism and related fields, and she's a wonderful mentor to really probably hundreds of people in our field. She's the recipient of numerous awards, including the Lifetime Achievement Award from the International Society for Autism Research. She has over 300 peer-reviewed journal publications, and she is arguably the most famous and well-respected autism researcher on the planet. She definitely has my vote there. So it is my great pleasure to work with Dr. Lord through the UCLA Tarjan Center and to call her a friend and an esteemed colleague. I truly don't know any researcher that's more dedicated to supporting the needs of neurodiverse individuals and their families. So we are very lucky to have her here today. And I hope you will join me in welcoming Dr. Catherine Lord.
Thank you, Liz. Can you hear me? Yes, good. I am also, it's very nice to be here. What Dr. Lageson didn't say is I'm the worst technology person ever, but I can see my slides. Can you see my slides?
Not yet, but if you share your screen at the bottom of the Zoom toolbar, that probably would do.
You know what? I cannot get to the bottom of the Zoom toolbar. I can see you, Liz, and I can see my slides, but I can't. Let's see if this works. Nope, that just meant I don't see you. Here, let's try this. Aha. All right, here we go. Share slides. All right, it's already gone on to the conflict of interest. Let's just go back. There we go.
There you go. I can see them. Have fun, Kathy. Thank you.
All right. Hello, everybody. I'm sorry for the chaos, but it's I am sitting in a hotel room on my air conditioner. So it's very nice to be able to talk to you as a member of the Tarjan Center, which is an incredible group of people, and as the George Tarjan Distinguished Professor. What I'm going to do today is talk about families and autism, with an emphasis on caregivers and siblings. And the first thing I need to say is this is really not my work. I'm in the background, but this is a work of the group of incredible dedicated students and former students, and many more people than I've listed here, but these are the people who are the main leaders of this research, and I don't want to forget them. As Dr. Lageson said, I do have conflicts of interest. I do get royalties from the ADOS and the ADI. I'm not going to try to sell you anything today, I promise, but you should be aware of that. And I'm on different scientific advisory boards and have funding from various places. So I think that the place I want to start is that autism is a spectrum. It's different in different people. And some people with autism go on to lead independent lives and are doing phenomenally. Other people are independent, but not so happy, just like the rest of us. Other people need very significant support throughout their lives, and many people fall in between. It also is different across time. So it's a developmental condition, and it changes with development, and it also probably changes development. And autistic people need different kinds of support at different times. And I think we need to remember that they're not living in a vacuum. At least during childhood, autistic children are living with a family, and those families need different things and value different kinds of support at different times. I also want to say right from the start that I think no one wants to make autism go away. There are incredible strengths in many of the people, really almost everyone that we meet who has autism. But with autism come other things that can be very difficult. And autism is different from normal development. And so we need to take into account what those differences are and how we can best support those differences. I also want to say right from the start that there are many evidence-based interventions that can make a big difference in people or autistic children and adults' lives, but predominantly their value is starting cascades of change, not accomplishing something that's done and never needs to be addressed again. And that's true probably for all changes in mental health and probably to some degree physical health. So we talk about interventions as starting and stopping and what is the outcome, but the outcome is a person, and a person is often in a family. And really what we want to do is get people going to do better things. The kinds of changes that interventions accomplish are gradual and usually small. So if we look at the major early intervention programs, we often have changes, these are in preschool kids, that are 2 to 3 months more than if the child didn't have that intervention. That's in a year or two. So that's a good thing, but it's not a miracle. We see changes of cognitive ability of 10 to 15 points on things like an IQ scale. That is good, but that is not moving someone out of severe intellectual disability into superior intelligence. And similarly, you see changes in social functioning. So someone gets a friend, or someone goes out more, or someone can converse better. All of those things are important, but the point is they're a start. And we can list forever the things that they lead to. And if we look here, this is just a forest plot of different psychosocial interventions for autistic children. These are children. And what you see is to the right of the line, those lines are significant changes above and beyond what you get from just time. And I think what's important here to see, these are small. And if we really control for example, studies that are done by the person who made up the intervention, or studies that have really good controls, the differences are smaller. It's not that they aren't real, but they're small. And what I want to come back to is the most consistent findings are for parent-mediated interventions in early in preschool years. And this makes sense for preschool children, but it's also true when parents are involved, and this includes peers, it includes BIACA, which is a modification of CBT, it includes self-determination studies. All of these are more likely to have changes if parents are involved. And I put this slide in just because what's so sweet about it is this is a boy who loves water. And what his mother is doing is actually holding the faucet so he can't turn on the water. So he'll get some soap and then letting him have water. So she's working around the things that he likes to do to help him do the things that he needs to do, like wash his hands. I think just another piece of evidence that I think is really good to motivate us is these are adaptive scores from people in our longitudinal study that I'll talk about in a minute. But the point here is that if we group our sample by people who had relatively lower nonverbal IQs on the left and higher nonverbal IQs on the right, you'll see that over half of these samples overlap in their adaptive skills. And what does that mean? It means that people who do not do well on IQ tests can still learn to take care of themselves and can still learn to do practical functioning things that will allow them greater independence. On the right, it means you can have people who can do these things any better than somebody who has much less cognitive ability. And I think both of these findings should be challenges for us. So what are we going to do? How do we get everybody up there to being able to take care of their basic hygiene and be able to participate in responsibilities around the house, which are important? And how do we make sure that people who are bright do not slip through the cracks? So I'm also going to show you data. This is from a study led by Sophie Kim, who is now in Seoul. And it's really looking at studies that did parent training. What do the families get out of it? And what changes in the kids? And these are all early intervention studies. And Sophie developed something called the MONSI, which is just a scoring of what strategies do families use when interacting with their children that may relate to the child being more engaged. And what she found was that changes in parent behavior, this is a paper reported by Bethany Vibert down at the bottom, changes in parent behavior accounted for the differences between kids who were in the condition where their parents got support versus the controls, who are the dotted line. And so this isn't us, this is the providers teaching parents and parents changing. They also found, this is a different study, that parents, this is that the more parents use these strategies, the more kids communicated. So we do know some practical things about how to help families, and families may use some of these on their own, great, and need to learn others. And these kinds of things, these are like setting up the environment, not having 5,000 toys all in front of the child at the moment. Child-guided intervention, so following the child's lead, looking at where the child is looking before you start talking. Active teaching, so having an idea of what would be reasonable for your child to learn next, and thinking about that. Opportunities for social communication, which is down there in the yellow, which is the hardest thing to change. And natural reinforcement doesn't mean bringing out the M&Ms, but it means saying, you know, if you can put your toys away, then we'll choose the next toy. So this is very complicated, but the main point of this, the outcomes, the BOSC are the kids, and the MONSI on the bottom are the parents. And the point is that the interventions really go through the parents in these cases. So I think I just love this slide, because this is something a family sent me that I did not prescribe baseball for this child, but he wanted to do it. The parents got him in it. And it reminds me that we need to think about families and long-term sources of support and meaning. And I think one of the hardest things as a clinician is to remember that what I do is absolutely puny compared to what families do. And if I can help a family, that is going to be 10 times more powerful than something I do, unless we have maybe an adult who is really asking for specific changes. I think the other thing, and this is all work from Sophie Kim's lab, is that parents are really different. This is where parents at the intervention. And you can see that, I mean, a Z-score is just the middle. You can see some parents are really good at setting up the environment and some parents are not. Some parents are really good at following their child's lead and some parents aren't. On the whole, parents were better as a group in engaging their children. So you can see the 5th dotted line over there. And then parents really varied in terms of being able to set up, do this, and then this happens. And what I wanted to show you here was parents, the outcome differs of the intervention by where parents start. If parents are really good at something before they start, they're not going to change very much. And those are those top lines. If parents are really bad at something, they're probably learn it. So that what we need to do in our interventions is be aware of what families already can do, so we're not wasting a lot of their time. But also, what do they want to learn and what would be really helpful for them to learn? So we have been doing a longitudinal study now for over 30 years, and we started with kids who are 2 years old, referred for possible autism. Not all of the kids have autism, even though we've seen them over and we keep looking for it. But about more than 3/4 of the sample have autism. I think the only treatment effect we've ever found in this study, and there's limitations to the study, is that families who got a diagnosis at 2, who found a provider who they stuck with over the course of that year, so at least 6 months of treatment, and who worked with them, not necessarily parent-mediated treatment, but included them in what they were doing, we see changes even at 19 and 25 years in those people that are now adults, autistic adults. And we see them across the IQ range. It's true for people with minimally verbal skills all the way up to people who are really bright. We see better adaptive skills, better achievements, their cognitive scores, and actually better peer interaction. Now, I think we need to remember this is not a controlled study, and that's why we got to be really careful that we're not showing that treatments don't work. We just don't have a good mechanism in this observational study. It also may well be this is the parents, it's not the providers, or it's a combination of them both. Parents who went from provider to provider and kept changing over that first year, the kids did worse than parents who didn't have anything, who probably just didn't have access or the resources to get to intervention. But we need to know more about what helps families when, and what are the characteristics of families. How can we support them? We can't make entirely different families, but we can support families where they're coming from. And this is just a slide which is just, this mother played Ring Around the Rosie with her child. And in the context of Ring Around the Rosie, this little girl who had really never said anything, a little girl with autism, learned to fall down. She loved to fall down. What she really wanted was everyone else to fall down. And they were able to build on that routine. But that was the combination of the mother who was doing this already, but wasn't quite sure how to set it up, and a provider who was working with her. So in our longitudinal multiple measures, which include parent reports and direct observations and standardized testing. And we started with 192 consecutive referrals for autism, 21 developmentally delayed kids who theoretically didn't have autism. Some of them later did. And then we added another 54. This sample is boys, about 75%, mostly Caucasian, about 75% Caucasian, 25% African American, and very few other races. And it's rural, urban, and suburban. We need to remember that this is a special sample of families who sought help for a 2-year-old 30 years ago and came to an autism clinic. These were free services. And so our families are working class. They are not in poverty, but they are not the usual typical sample of more affluent, more educated families. But I think one of the things we're actually sad about is initially, because this was such a special sample of people who were willing and able to come for help, we didn't see social determinants of health. We didn't see race differences, education differences, income differences. And now, as our population moves into their adulthood, they're in their 30s, we begin to see this because we can't, in the United States, we can't protect people. So what factors affect caregivers' well-being and their perceptions of their lives? That's what I'm going to address here. So we asked families, we gave them something that initially was called the burden scale, which we'd like to retitle, but it asked them, how did having a child with autism or a developmental disability affect their family in various ways? And this included their work, their spouse's work, finances, where they lived, their social lives, and their siblings. And the primary positive factor was, these were mothers reporting, was family support, mostly from the husbands. Families also reported, so the only positive impact that came out of this was families saying that they loved the positive. Perceived negative impact was quite different for different families. And here you'll see lines of how it changed over time, because we were able to ask families these questions over and over. Higher is worse. I think that we had done this first at age 9 and then did it again at 14. And what we were worried at 14 was it seemed like it was going up for teenagers. And in fact, it was, but when we looked at the data again at 19, what we found was that really there's only one group. There's a group in the middle where people reported a harder time when their kids were teenagers. Everyone else actually was pretty constant, and things are getting better gradually. When though, and who was in this group, what we found was that in our sample, particularly the teens and adulthoods, African-American parents with less education reported less negative burden. And I think this may be just because they're more resilient, they have more other challenges. We were a little bit worried that most of our staff is white, and so this might be just a reluctance to tell white people about this, but we've also had significant numbers of African-American staff, and it didn't seem different. What is also really important here is that the negative impact of having an autistic child was not related to autism, because we do have people with and without autism. It's not related to severity of intellectual disability. It was particularly related to things like aggressive behavior, irritability, and repetitive behaviors. And mixed into repetitive behaviors are sensory issues. So those particular things cause challenges for families that reverberate through the family even more than typical concept social education. Looked at in our population, and we know that some people claim that there's many more divorces in families with autism. We could not find a control or comparison group, so we don't know if it's more. But the reality is that 40% of our families got divorced at some point or other. Actually, that's not true. It's about 33% of the families got divorced at some time or other, which seems pretty comparable to US statistics. The 40% that you see on this slide is actually of the divorces, 40% of them occurred before kids were 5. And that is actually also typical of non-autistic population. What is interesting about that is that it then drops very considerably when the kids are 5 to 10, and presumably they're in school. And then starts creeping up as kids enter their teens and adulthoods. But it's very different in the initial divorces between 0 to 5 and 5 to 10. There was no particular IQ effect of the kids, no particular effect of severity of autism. Over 10, parents of brighter kids were more likely to get divorced. And I think part of this is partly services and partly the stress of not knowing quite what to do. We also did find race by education effects later on. And again, this is, you'll see my little crude circle. Again, it's particularly for African-American families with less education. We did find that parents of autistic kids had a slightly higher rate of divorce. This is later And again, it's related to the brighter autistic kids. And then we found it, I'm not sure what this means, but about a quarter of our sample have then subsequently had another autistic child. And there we found that those families did not get divorced early on, but began to get divorced as kids got older. So what does this mean? I think we need to remember that it's not just autism. And in fact, sometimes it's not autism. The clearest factor related to divorce and to parents reporting difficult times are specific behaviors, aggressive behaviors, irritability, general externalizing behaviors of kids who have tempers or get mad. It is particularly hard for Black, less well-educated families who we know don't get services. We did find that younger mothers were more likely to get divorced, and these were mothers generally in their early 20s, and no effect of having siblings except that it moved it to the later years. And this finding that we were not expecting, that parents with brighter kids were more likely to get later divorces. So we need to look beyond child characteristics. I mean, it may be difficult to have an autistic child, but there are also other factors. And we were interested in how do these things change over time? And what are the sources of support for families? And what do particularly mothers who are better at filling out our forms than the dads? And I just put this slide here because this is a video, which I'm not going to show you, of a mother who had to sing her way driving her child to school because he wanted to turn down a particular street. And sometimes he couldn't. And the only way that she could get him past it, you can see he's singing loudly in order to not scream. And the point of just how tough it can be to get your kid through various ordinary circumstances. So this is an analysis led by Hilary Schultz, and it's about family support. And sorry, I need to just, what you can see here, this is change over time. So on the whole, families report that support from other family members is the most helpful thing. They are less likely to use it as their child gets older, and if their child has autism, as opposed to other neurodevelopmental disorders, they're more likely to use it. And they said the value has not changed over time. This is looking at from mid-childhood into adulthood. Other informal support they found declines more, and this is friends. So it's harder to leave your adolescent autistic child or young adult child, if you need to, with friends for supervision. They still do it. It's still more related. They still need, people who have autistic kids need more help. And then formal support really declines. The use declines. It is related to verbal IQ because it's harder and harder to find services if you have a child who is very verbal. And the value declines. And they think parents report that this is less useful than it was when the kids were younger. Oh, you know what? I'm stuck on this slide for there we go. So we then, another of my colleagues, Hannah Singer, asked about what do parents do to get through difficult times? And we used a scale that looked at these different kinds of coping strategies. So active avoidance, problem focused, which is trying to specifically change something, be positive, religion, and denying that it's happening at all. And we looked at how these coping strategies worked over time. The clearest effects were from religious coping and problem-focused coping. And what we found was that high religious coping was related to parents' well-being. That is how parents felt like their lives were going, was very positive related when their kids were younger, but it declined as kids got older and into adolescence. It wasn't enough to keep people going, even though it could be very helpful when their kids were young. Problem-focused coping, so saying, I'm going to try to deal with what do I do when my child is just screaming and yelling at me when we're driving by a street he'd like to turn in. And positive coping of, I love my child, I need to focus on the positive, were related to parental well-being especially for parents who had kids who were doing things that were particularly difficult. So kids who were hitting or yelling or aggressive behavior. And it also particularly worked for African-American families not necessarily interacting with these. So we wanted to take this information and move to siblings. And this is from a family that, thank goodness, sends me wonderful slides with a little girl, not so little girl, on the right with autism. This girl was lucky enough to be born into a family with 3 sisters and a mother who was a powerhouse and a dad who has been incredibly supportive. And that has made all the difference. And we have been trying to pull out the general factors behind the influence of siblings. And this is work of Nicole Rosen and Jamie McCauley. And what we found looking at adaptive behavior was the presence of a sibling. So this is over on the slide on the left, and then looking at the box on the right, kids who have a sibling actually have better adaptive behavior. And their adaptive behavior changes in a more steep way that is faster over time than kids who don't have a sibling. It turned out that the most helpful thing to have a sibling that was the same gender as you. This is not something we can do. We can't program the gender of other kids, but it is something worth knowing in terms of seeking resources if you have a girl who's got a bunch of brothers or a boy who has a bunch of sisters or a sister. It also turned out that when we looked at teacher reporting maladaptive behaviors, and again, this is coming back to that notion of irritability and externalizing behaviors, teachers reported fewer of these behaviors in autistic kids who had siblings, and the same thing. And that the kids were more likely to change over time in a good way if they had a sibling. The one exception was if they had a sibling with problems. So if they had a sibling with a medical condition or a sibling with also high, for example, severe ADHD or behavior problems, then those kids made less progress. And I think this is not to blame those siblings. That is not what we're trying to do. But it is to say at a point that we need to be sure those siblings get help. And that life as a sibling of an autistic kid may not be that easy. And we need to recognize it. So this is from a Lancet commission that I was part of, which was trying to propose a health model for autism. And the idea was that we would take the idea of stepped care, which is trying to do the thing that works most effectively and cheaply, start there. But often when people talk about step care, what they mean is what's cheapest or most convenient for providers or for hospitals. And what we wanted to do was say what makes the most sense for families, start there, and then add more intensive or other kinds of services. So just to give, and what the first thing that we did, this is in the longitudinal study, was we asked families and we asked autistic adults who could speak for themselves, what's most important for you? And I think the most important thing that I like from this slide is the goal. This is work from Hannah Singer, was that almost everybody that we asked had some particular thing that they really wanted to accomplish. And that kind of thing could be, I want a credit card, or it could be, I want to be able to make more food than a cheese sandwich, or something in particular. And this was true both for people that could speak for themselves, but also families speaking for their kids who did not have enough language to answer this question. If you start here with parents of children, these are adult children with intellectual disabilities, parents wanted happiness. I mean, and they were worried about who was going to take care of their child when they were not here. These families are now in their 60s, and they are going to live hopefully another 20, 30 years, but they're still worried about it. Families were less concerned about jobs, although they still wanted their kids to have something to do, and much less concerned about friends. If we look at adults with without intellectual disability speaking for themselves, they also had particular goals. They wanted to be loved, and they did want to work. So not everybody, but they wanted to have some kind of employment. Families also, these young people wanted friends, and many of them wanted children. And so we need to recognize that. And when we look at their parents, again, for them, and they sort of grouped it, they wanted their kids to have a family. They were worried about housing, again, worried about happiness, which nobody says for themselves, but parents always say for their kids, jobs, and again, friends. So we wanted to start from there. And this is just an example of the idea of step care. I know you may not be able to see these little tiny things, but the point here is, say we have a minimally verbal child, a 5-year-old who lives this here, I mean, the Lancet was international, so in a country that does not have a lot of resources. And this, we know that this 5-year-old is great at running, but not at talking, could not talk to someone he doesn't know and really doesn't talk. We know that he does not respond to his name yet. So he has limited abilities right now. And we're worried about safety. So that's where we need to start for him. And his family is worried about him eloping, taking off. The family is very eager for help. And what do? I mean, what makes by far the most sense is to work with the family at home, even though it's cheaper for me as a provider to see someone in my office. If this is an issue of this child getting out various doors and where is he going and when is he doing this, it makes much more sense to start right where this is happening. So a different situation would be a 15-year-old girl, a 15-year-old girl with autism and social anxiety. And this girl is saying, I am not happy. She is quite bright, quite able to speak for herself. We would probably say she has good adaptive skills. She goes to school. She's in regular school. She has good cognitive skills in the sense that she's very good at math and hates Shakespeare, but can talk, and is predominantly unhappy at school. But she has real interests in math and art, and she wants help. And she is interested in, is there any medication that would make her feel calmer and less stressed? She's also willing to participate in a group and wants help. So here she's in a different position. And it may be that, for example, she lives in a city where she could travel to come to a group that would help her. It would require some effort on the part of a caregiver. It may be the medication would help, and it's up to, at this point, to her and her parents. And she is interested in groups, which is not true for everybody, but can make a huge difference. I put this slide, and I don't know if this will, yeah, okay. This slide here, just because it's a physical example of a child who's got his own, he's on his own wavelength. And we're trying to do a classic joint attention task here where you'll see the therapist coming over and trying to get him to follow her shift and gaze and follow her pointing. And you'll see in a minute why I'm using this as an example, but just see what he does.
Press this. Press key. Steven. Look. Look over. Look over here. Look. Good for you.
So what I wanted you to see, this is the same boy. He's not a boy anymore. He's the first person that is in our group who got married, and this was the wedding invitation. But what I wanted you to see there was even as a young child, and that's where I think the autism comes in. He was trying so hard to figure out what on earth Pam wanted from him, but he really didn't understand that the idea was for him to follow where she was looking and then follow where she was pointing. But he tried by leaning to her. He tried by getting his finger out. He tried matching her pointing. And at that point, he saw the car across the room. So he got there. It's also the case for this young man that he put himself through college, working for an airline as the person who directs where the planes land. I mean, a very responsible, but not very high level job. He got a degree in engineering, and for the first couple of years, he would not change his job. And the airline kept saying, "What are you doing? You're an engineer." Finally changed. He is moving up the ranks, but he is doing this at his own pace. And he has done this. Now, he has not done this by himself. You'll see his family is there. He's got great family support. So where can we go with all of this? Families matter, and often I think we don't pay enough attention to them. It can be difficult to do during an assessment. A kid comes in and we're focused on, can we get a diagnosis? And then we're going to give people a huge list of what they can do. We also, even in treatment, often then what we do is focus on the person we're treating. And that gets better. It's wonderful to see. And we love the autistic kids and autistic adults we're working with. But the reality is, what's more important often, not always, is what's going on in the family. Recently, my student, Nicole Rosen, has been doing work with siblings, and we've been talking to the siblings of the people in this study. And they tell us they're on the whole not complaining. They love their siblings. They're trying to figure out how they're going to live the rest of their lives with these siblings. But they also tell us about years when other people came into their house to work with their siblings, or they were hauled off to speech therapy and feeling neglected. I think the point of our research is that siblings can make differences that are both positive and negative. And one of the things we ended up doing in our New York clinic, because we kept bumping into siblings when we saw the kids all the time, was we started asking parents to bring the siblings in and let us meet them and just start from what is going on. We also need to remember that factors that affect parents are not necessarily autism diagnoses. And issues like child irritability, just having a child who is more grouchy than most kids does not mean this is a bad child. It's just harder to deal with somebody grouchy, or someone who has a temper, or someone who is very sensory responsive. So we need to figure out how to do that and not just deal with social communication. Different parent coping styles also work better at different times, and different people need to learn things. So we don't need to teach everybody the same thing. And the perceived impact, that is what families say is tough on them, and actual stress may not be the same. And I am worried that we're not doing a job, particularly low income families or families that don't speak English or don't speak great English, and they just fall between the cracks. And they also may not complain as much, which is not fair. And finally, we were struck by the increased divorce rate in the more able kids, parents. I think we also have to remember as Americans that existing service systems are not necessarily designed to meet the needs of autistic individuals around what is available in less affluent countries, and that 95% of children under age 5 with developmental disabilities live in less affluent circumstances. And this is a drawing by one of my former students who I just met, is now a postdoc in clinical psych. But the idea is just that there are differences, and we have to remember that autism is really heterogeneous, and you can go up this tree in different ways, and you can go out on a limb. If, for example, you have autism and ADHD, that is going to be different than somebody who is more placid, and we need to address that. Also, we could add strengths in here as little branches of if you have autism and ADHD and an incredibly talented musician, it's going to be different, and we need to think about that. And in the end, what I really like this slide, which is made by Andrew Pickles for the Lancet, but you see these little red lines here, and what those are is the level of opportunities we have. And the point is that there are people with autism who are minimally verbal and profoundly autistic. There are people in the middle, and there are people who have done incredibly well. If we raise the level of opportunity and support, everybody will go up. And it doesn't mean that everyone will be the same, but more people will be able to do more. And that's what we want to happen. So I want to thank the families of this study. This is a mother who has hung in there with us for 30 years, and the participants who have been very tolerant of our invading their privacy, and all the people that have worked with me. Thank you very much.
Well, thank you so much to Dr. Lord for that interesting and informative lecture. You know, I've been attending lectures and presentations by Dr. Lord for over 20 years, Kathy, and I always learn something new from you. So thank you for your insights and your research. You know, in about 15 minutes, we're going to be hosting a question and answer session. So we welcome you to add any questions that you have for Dr. Lord or for our next presenters in the Q&A, which can be found on the Zoom toolbar. Now, as part of this forum, we've invited speakers from the community to provide their perspectives on the topics that we're covering. You know, I think so often in conferences and lectures, we feature scholarly experts, you know, in the fields of interest, which is great, but we often miss the opportunity to hear from other types of experts. And that includes parents, self-advocates, you know, and other stakeholders. And so in that spirit, I'm very happy to introduce you to our first community discussants for the UCLA Tarjan Center Forum, Drs. Allison Gilbert and Dr. Andrew Gilbert. So just a few fun facts about the Gilberts before they introduce themselves. So Allison and Andrew are the parents of two boys, ages 13 and 11. Their 13-year-old son is on the autism spectrum. I understand that both boys love music and skiing and playing video games like lots of young people. They also enjoy spending time with their dog named Waffles, which is a super cute name. And the family lives in Long Island, New York, and the boys attend the same mainstream middle school. So we are very grateful to have the Gilberts here today to share their perspectives on the roles of caregivers and siblings and autism. And I'd like to have you all join me in welcoming Drs. Allison and Andrew Gilbert. And I believe we're going to even see a video from their children.
Hi.
Hello.
Thank you for having us. Can you see us okay? Yeah, okay. So we're thrilled to be here. We have been working with Dr. Lord since our older son, who's now 13, since he was about 2.5 years old. And this is a little video clip of the two boys. Max is in that Buckley shirt, and he's the one who has autism, and Jake is wearing the shirt with the blue sweatshirt with the goat on it. He's 11 years old, and he is neurotypical. So we'd love for you to watch them interact a little bit.
Like about being brothers is that you're funny. And
Wait, you started recording?
what?
Oh.
Keep the recording on. I love that you're really funny, and I would like to play games with you. What do you like about being my brother?
That you have a nice smile and you always make me laugh, and I love you.
Okay. What?
Waffles is behind you, Mom.
Please, Paul. What I like about being brothers is that
Hold
Oh,
up. Andy, you want to introduce this one? Yeah.
Oh, and this is just a very brief clip of them with their Jake's brand new Halloween costume.
Figured it out. Wait, there's these little holes you put your hand through.
oh,
Now I'm talking.
And so, you know, one of the things about that particular video is, I think, you know, Kathy was alluding to the relationship between siblings, especially same gender siblings. And, you know, one of the things that we found as parents is that, you know, they are children have helped each other in so many ways. And we always try to emphasize that how they're learning from each other. And so in that particular clip, Jake has this unique ability to engage Max, which is particularly challenging at times when Max doesn't want to participate. And Jake just instinctually, I think, has learned, let me get the biggest, baddest, most silly costume, and I'm sure I'll get my brother's attention. That's not the only reason he got that costume, but
It certainly helped.
it certainly helped. And so we're also happy to answer whatever questions folks may have.
Okay, well, thank you so much to Doctors Allison and Dr. Andrew Gilbert for their thoughts and insights into family perspectives and autism. Also a big thank you to Max and Jake for their sharing that sweet video, or the two videos, with our audience. We're now going to open it up to our Q&A. And so Dr. Lord is going to rejoin us. And if you have questions for Dr. Lord or for Allison and Andrew, you know, please submit your questions on the Q&A toolbar of Zoom. But to start us off, our first question is for Dr. Lord. And the question is, how can we help professionals be more aware and useful to families, including siblings? And what are the barriers for this happening?
Actually, I just wanted to say thank you to Andy and Alex and the boys for doing this. And that I was going to say, but I wasn't quite sure when to say it. I asked them to do this because their family is so part of their lives. You know, as long as I've known them, you know, they are thinking about their family, all of them. And everybody has their role and strength, and that is an amazing thing to see. So I think that part of the barriers are, you know, just billing, and that we get focused on, I'm doing, you know, you get paid more for individual psychotherapy than family therapy, which is ridiculous. And I think we get focused on our goals, and we get focused on autism, and, you know, it just trying to remember what is important is an effort when we, you know, are trying to do, for example, quite focused evidence-based interventions. And this is not to knock those interventions at all. We need them as a structure, but being able to move out and say, okay, what does this actually mean? My poor graduate students have just heard me harping about not giving lists to families, long lists of like, here are 24 things you can do for your child, and here are 40 numbers you can call, you know, most of which won't answer or will be so expensive, or, you know, so trying to be realistic and just remember that, first of all, everyone is a person, including the autistic person. You know, even the kids, these are people. And I'm not saying be so loosey-goosey that you don't have specific goals, but I am, and you don't use evidence-based interventions, but I am saying try to keep the families in mind, because they can do so much more, the reality is, than we can in most cases.
Yeah. Well said. You know, I think even though that question was for Dr. Lord, I think I'm sure the audience would be curious to hear from Allison and Andrew about that too, about how professionals can be more useful to families, you know, including siblings. And if you see any barriers in that happening.
Go ahead.
Sure. I mean, I think that it is important, especially when you have, at least from personal experience, especially when you have providers who do come into the home, that they are paying attention to the interaction that goes on. So we were very fortunate to have early intervention and to have, you know, pretty skilled adults coming in. I mean, we also screened whoever was coming into our home personally, which I think again is another way that parents can participate. But the folks who were in our home working with Max, they included Jake, and if they didn't, then we asked them to. And I think that we understood that the family dynamic was going to be important. And certainly there were times where our Max could benefit from working independently. And then there were times where we said, let's get Jake in here. Like, one, it's really important for him to have the attention. He sees that, his brother's getting some attention. He also needs to benefit from some as well. And then we also know that the interaction is going to be important for both of them for so many reasons. And so I think parents can be really proactive in enlisting the support of professionals and helping to make them aware of the things that matter.
I think I was just going to say that, we also just had great guidance. Kathy was our leader from the start, and but I think just the fact that this was made very clear very early how important it was. She recognized it. She let us know and really encouraged this model of like, all right, you guys are so important here, and then that just, I guess cascaded, and built. And I also think that trying to push for collaboration between caregivers is really important.
Yeah.
If you can try to get them to have some kind of communication and maybe have some team meetings, or if not, just that they're communicating with each other, and that goes a long way too.
Oh yeah, and I think actually, Andy, you were the one who said from the very beginning, we need somebody who really can kind of spearhead this and sort of lead and collaborate. And that is actually where Dr. Lord has come in, and we felt incredibly thankful and so blessed. I think she knows that, because
That's a great model.
that was
that
was huge. I mean, it was huge to have somebody who really understands the dynamics of the providers and who can sort of say, this is the direction that we're going in. And I think people can find that in other places. Obviously, incredibly fortunate to have Kathy doing this with us, but I think it's being aware that as a family, you could be proactive and try to set something like that up for yourself, and insisting, we all need to meet. We all need to be on the same page. Who's in charge? Because there are so many providers from so many different places at certain points and at different points in a child's life, that, that collaborative piece and the continuity is so essential.
And I think just to add, in our study, the families that found somebody in that first year, they were all kinds of different professions. They weren't just psychologists or psychiatrists. They were often speech therapists, sometimes an OT, sometimes a special ed teacher. And I do think it actually can be cost effective, even though if you have to pay everybody to get together, that gets expensive. But I think the reality of having, once a month or once every 4 months, meetings where everybody talks to each other and families are really listened to, which is somewhat different sometimes than IEPs. I mean, it's sort of the same idea, but it's a different, if it's organized by the family, I think it feels differently sometimes. And working with schools also,
Oh, yeah.
Yeah, such a good point that everybody needs to be on the same page and communicating with one another. And that involves a lot of, managing kind of complex communication. And, you couldn't have a better case manager in that way than Kathy Lord. Oh my goodness. How lucky do you feel? And we, I know Kathy, right. Knowing Kathy too. I mean, Kathy says what she thinks, and we all love that about her. She's very, very honest and kind. But some professionals aren't always as comfortable in really sharing their thoughts and ideas, their suggestions. And part of that too, that you mentioned that was so helpful with Kathy, was talking about the importance of you as caregivers, through this process. And so one of the questions, of course, here that I'm going to segue to relates to this. And that is for Allison and Andrew, how can we help parents, or I think they mean as professionals, help parents be open to making changes in the family dynamics and family systems. What did Kathy do that helped you to be open to that?
Yeah, we were brainwashed in a good way. No, I think a lot of what we're discussing happened, and just I think education is huge, and just teaching us about about autism and what it looks like, and us teaching our family was really important. And look, we have to, I guess we're modeling for our son, but also we genuinely, a lot of the same things that we're trying to teach our son, we have to teach ourselves. We have to be flexible, we can't be too rigid, we have to be open, we have to be patient, we have to take a breath, all this stuff. And anyway, go ahead.
Yeah. I mean, I think Max has taught us so much. I think it is, I think our children in general teach us so much, and that's where becoming a parent is just such a wonderful thing. I'll admit, I think, and I think Kathy knows this, that this was really hard as a mom. I'm not gonna lie or sugarcoat it. It's not what you expect. And I think there's a process involved in order to be able to get back up on your feet and say, this is going to make me stronger. This is going to make me better. My child is going to be okay. And I think that's a very real process for people. I don't really want to label what that is, because for everyone it's sort of different. But for me, it was sort of embracing uncertainty and saying, look, people have kids and they're okay, and sometimes they're not okay, and sometimes they're fine for a while and then they have problems, and this is life. Like, life takes you on a journey. And I think it's adjusting expectations, it's embracing uncertainty.
Yep.
It's letting go of blame. I remember saying to Kathy in her office, why the hell did this happen? And getting kind of stuck on it and having to get myself somehow unstuck. And I think part of the way I did that is obviously Andy, who's an incredible husband and very wise, and loving. And I think, we also have family that, are so incredibly optimistic and supportive and helpful, and whatever, uncertainty they felt, they were strong and didn't really share that. They shared really all the positive to help us and our team and Kathy. I mean, I think Kathy knows there were times where I was in tears in her office, and just her level of support and guidance and knowledge and education. And so there's a lot, and I think there's a lot of barriers to getting help, asking for help, and advocating, and they start with this idea of just of being able to embrace your world, embrace your family, love every little thing, whether it's a challenge or a talent. And I think that's just such a huge piece. That's really where it begins.
Yeah, beautifully said. And really actually relates a lot to another question that came up in the Q&A toolbar for Allison and Andrew about how we can help parents embrace, I love the word embrace, their new identity, as a family of a child with special needs. And you just talked about some of that, about embracing uncertainty. I don't know if there's anything else you want to add, but again, beautifully put and really meaningful. Thank you.
I mean, I think the other thing to add is not being afraid to look into, the community early on, because you really do see that there's so many people who go through so many different things, including what you're going through. And I think when you cut yourself off from that, it makes it harder. And so, I would just say that, when you feel ready, it's really important to look outside of yourself and outside of your immediate family and understand that there are so many people that go through so many things, and some of them may be very similar to what you're going through, and to create that support system for yourself and not isolate yourself. Because I think then that can lead families or parents to be, to become depressed or down, and that doesn't help you, and it doesn't help your child. Sometimes those things happen, but I think I would encourage people to really use the social support and reach out, because I think it really does help.
Yeah.
And I'll just add, I think it is a process. I mean, I think you guys are a perfect example of, I remember when, Jake was just born. Oh my gosh, you guys, Jake was a baby and you were coming in and, with all the stuff for the baby and the 2-year-old, and
Oh, yeah.
Max would not carry anything in his, he wouldn't carry anything in his hand. And oh my gosh. And then you weren't sure you wanted anyone to know about this yet. And
Oh, it's hard.
but I think you can't rush it, and you have to give people time to get used to it. And now you become major advocates, but it was, you had to do that on your time. And at least my bias is families need, everybody's on their own schedule. And as long as they're doing the right things for their children, they will find how to balance this. And, Max is, we were so worried about what happens when Max realizes he has autism, and now he's a pro, but he's also a talented artist and an incredible musician. And so autism is just tossed in there, but it takes time.
Yeah, and that's similar to the young man that you described, going at his pace,
Yeah.
and embracing that. I think that also with regards to siblings, we also had to do that with Jake, and it was a process introducing this concept to him.
Oh, yeah.
And helping him understand that and embrace and accept that. And it worked, but we're all still learning, obviously, but that was also a process. But that was so valuable because he's been such an important part of the family and also just Max's growth. His brother has just been so important, so powerful. And
Yeah, it's been a huge factor. I was gonna add that oh no, I can't remember what it was.
Okay.
I don't remember.
It's okay.
It's okay.
I always say if it's important, it'll come back, right?
It'll come back.
But thank you. Your family is just so inspirational. And I love so much of the focus being on the strengths too. And identifying all of the wonderful qualities that both of your boys have. And I'm also hearing this theme of this is a process, that it doesn't just happen instantly, like you flip a switch or something. But so thank you for your inspirational comments and sharing your story. I have another question for Dr. Lord, which I love this theme about, focusing a lot on parents and family perspectives, which I think we maybe don't do enough often in this field. And so the question for Kathy is, how can families stick up for their own needs and values, particularly, when they're benefiting from interventions, but they know that they need more?
I don't have the solution. I think you just have to stick up. I do think find champions, and that champion, it does not have to be me, or it does not have to be, an academic, but I think look for champions, friends of yours, other providers who will hang in there, who you think really get your family and also your child. I think don't be afraid to ask. Don't be afraid to say to them, to people, this is good, but I think I need more. How do I get it? Because I do think that often people do give you the minimal, or we're all encouraged to decide, what is the shortest we can do? What is the least because it's cheapest? So I do think, trying to think what do I really need? I think also to really think about your child, and are there other things that might not be therapy, but that might be just as good, not trying to save therapy, but just saying, could your child be in a soccer team, or is there a music teacher, or is there some, who is there that will give your child that support and engagement and positive things? And then how can you get it? And then using resources, again, don't be afraid to ask. And I realize it's easy for me to say, I'm not making 40 phone calls to find, but if you can do it, if you can find people who know things and just go through the chain, I think that will work the most. And don't give up.
Yeah. Kathy, I was gonna just piggyback on that because I think just as an example for parents who are listening, like when we found that, you know, there were issues going on, you know, gross motor, fine motor. I mean, we did things like piano or drums, you know, just because, like you said, soccer. Because like you said, you know, the providers, they're not always there. Sometimes it's, you know, the minimum. And so it, you know, incorporating it any way you can, I think is a big piece of it, like you said.
And you could be selective. I mean, we tried at different soccer teams and different piano
Right.
teachers, and we found just this amazing, naturally gifted soccer coach who's just so good with him. And it went such a long way. It was a really big, he was another team member, you know, and yeah.
And I think that is part of it too. It's like you're the parent and you know your child best. And so trusting your instincts as to who is going to be a good fit for your child. And then not being afraid to sort of say, you know what, I think we're going to try something different and see if that works better or not. And so we've done a lot of that. You know, it can be a lot of trial and error. And as Kathy was referring to, you know, throughout development, things change. And so then sometimes you do feel like something that was working isn't working anymore. And okay, let's find a different teacher for that because now this isn't working quite like it did in the past. So, you know, it is another job. I mean, I definitely feel like I'm a working mom who also has this other job of doing everything, you know, for both my kids and then some extra with Max, you know.
Well, there is the saying, it takes a village to raise a child. I think that's probably true for all kids, maybe especially so for kids with special needs, but it's okay. I hear the message is it's okay to seek those supports, not even that it's okay, but that you need them and they will change over the lifespan, like for anyone. There are so many positive and, you know, encouraging comments in the chat, so many words of gratitude to all of you. And it's hard to pick the questions, but this one's coming up a lot. I think it can be for all of you. What are your thoughts about including siblings so they feel included, but not putting too much extra pressure and responsibility on them to take care of their autistic sibling? Isn't that a great question?
Yes.
Yeah.
Yeah.
I mean, I would say absolutely include them, but you do have to be careful, you know, and I think that the reality is that the siblings do feel pressure. I think pretending like it's not happening is not good. You need to recognize it. Even if you're not putting the pressure, the siblings are smart enough to know I need to step up here. And so just making sure the siblings get some time to themselves with their parents, I think is really important because sometimes that goes by the way. I think being honest about as the future. I mean, right now for Max, we don't know what, you know, as an adult, how much help he'll need, if any. But I think that one of the things the siblings tell us is their parents often just don't talk about it. And I think even being able to say to your child, the sibling, we're putting money away, you know, this is what we don't expect you to do. Let's figure this out, particularly as you go into adulthood. So I think being as transparent without, you know, being aware that they are stepping up. I mean, but I think as Ali and Andy said, they gain something. They love their siblings. And so this is not just a one-way street, but they do end up with responsibilities. And that's why many of them, I mean, I think it's true for you, Liz, too. We have, you know, half of our students have autistic siblings. And hopefully they're going to all go into, I mean, I want Jake to run for president, you guys. You know, but anyway, what do you guys think, Ali and Andy?
I was going to say, I think I'm thinking of, you know, Jake, and I do have to really catch myself sometimes. And I think we just have to, I always am trying to be mindful of this, that, you know, I'm sometimes if it seems like I want him to be a little more flexible with his brother, I might think I'd, you know, tell him that, oh, but remember he has autism, and I have to just stop myself and, you know, and say, no, you don't put that on Jake. I mean, he, you know, just praise him for being supportive, but he's also a kid growing up, you know, and doing his own thing, and he's not responsible for Max and his condition, and just, but it's constantly kind of reminding myself, you do have to be very thoughtful, you know, about what you say to the sibling and the messages you send. And I think more just along the lines of praising the positive behaviors, and just telling, we're doing this all the time, just how great a brother he is.
Yeah.
And telling them both too, you guys are great brothers too, you know, you really, but especially Jake. Anyway.
Yeah, I mean, this just like really flew right in my face like 2 weeks ago. Jake is 11, and he said to me, Mom, and we were eating together in the living room, he says, Mom, he goes, is Max gonna like need someone with him when he grows up? And I'm like, okay, this is a moment. Like, I have to like catch my breath. Like, how am I responding to this? And I basically said, well, Kathy said, actually, thankfully, now I know I said the right thing. I said, I don't know. I said, I don't know. I said, that's such a thoughtful question, and I love how you care so much about your brother. And I don't know. And he said, okay. And that was the conversation basically for now, right? Because I know Jake's probably going to bring it up again.
Yeah.
But you know, and so I mean, you know, look, for our kids, they're both very verbal, as two of us are, and so they do talk a lot and they express themselves a lot, and so we hear what they're thinking a lot of the time, and so it does eventually come out. I think there are certainly many kids who are thinking it but don't, you know, really articulate all of this, but you know, you have to anticipate that it is something that is on their mind, especially as they're 11, 12, 13, and you know, really kind of those sorts of age ranges, they kind of do, you know, it's not like they're not thinking about it, right? So yeah.
Well, I can't believe we're already out of time. I mean, I feel like we could just go on, and I'm sure our audience would love to ask more questions of you, but I really want to thank you all so much for sharing, you know, your insights, your expertise in such an important area. And also thank you for all of the positivity that you're bringing to this conversation. I think so often in talking about autism, we talk about challenges and barriers and things that feel very negative. And I love the positivity of your family and all of the wonderful strengths and supports that you bring to each other. And that goes for everyone in your family, right? So thank you so much to Dr. Lord for sharing all of her expertise with us, to Allison and Andrew, to your boys. Thank you for being here today. We're going to toss it over to our Director of Training, Dr. Jasper Estebillo, who is going to tell us what's next. But thank you all so much.
Thank you.
Thank you so much.
Thank you
Thank
all.
you.
Thank you so much to Dr. Kathy Lord for highlighting the importance of families as long-term sources of support and meaning, and really encouraging us to look beyond just these child characteristics. Thank you also to Drs. Allison and Andrew Gilbert and their children for bringing your personal touch to the forum and sharing about your family and how to embrace neurodiversity, every challenge and every talent. And to Dr. Logson for moderating that rich discussion. What an amazing start to our forum.